Thank you for joining us today on another installment of Frost & Sullivan's exciting podcast series highlighting key disruptive technologies, growth opportunities, economic trends, new business models, industry convergence, emerging geographies, and much more. We will now be listening to Reenita Das, Partner and Senior Vice President of Transformational Health Division at Frost & Sullivan, explaining what's driving the monumental changes in the healthcare industry at the 2019 Dubai Health Forum.
So why the need to change healthcare today? What are some of the driving forces that we see that are creating this change? The first thing is that the healthcare business globally is completely unsustainable. In the United States, it's about 18% of GDP. It's $3.7 trillion in terms of cost, which is huge. The other factor, if you look at it, is that in 1965, healthcare was 5% of GDP. Today, it's 18%. So if you take the average cost of healthcare in 1960, it was about $147 per person. But today, that has gone up to more than $10,000, which makes no sense because it's not going in terms of the base of GDP. If you relate that to, say, how much you bought a car, in 1965, you bought a car for $2,600. And if we take the same price of healthcare increasing between 1960 today, it would be $180,000 for a price of a car. And we know that's not the price of a car. So something is wrong in what we are doing. I think the second big thing is that there's a huge gap in terms of treatment and diagnosis. There's a gap in accuracy. 40% of all diagnostic tests that are done have to be repeated. 60% of drugs that are prescribed lead to some kind of side effects or hospital readmissions. So something is seriously wrong in this picture because we are not personalizing it to the person that we're giving the drug or doing the diagnostic test to. Third big thing that we find in healthcare is that even though healthcare is a science, it's based on scientific facts and principles, less than 50% of healthcare is evidence-based. The rest of the 50% is actually based on gut feel, the surgeon's experience or the doctor's experience over time, and clinical studies. That's all. So it's really a discipline that's not as accurate as we want it to be. The fourth big factor that is driving healthcare is obviously the aging population. We're looking at 25% of the population being over 65 years of age in the next 5 to 7 years. Japan is already facing that epidemic. So that means, based on the 80-20 rule, 20% of the population is bearing 80% of healthcare costs, which means really that we have to look at where the money is being spent, which is on the aging population. And the last factor that we see is that obviously there's a huge disconnect between outcomes. And some of this is being looked at and reviewed based on the new models of value-based care that we're looking at. So in my belief, I don't think the problem is in terms of technology. I think today we have a lot of technology. I think the challenge today is on productivity, making the healthcare system much more productive. 60% of hospital costs in the United States comes from administrative waste, and we're really looking at a system for how we can make the system much more productive. And in my view, data and machine learning can definitely help by creating the algorithms and the systems by which doctors can do their jobs much more easily and seamlessly.
We hope you found this podcast insightful. Check out the space for more exciting updates on the future of health from Frost & Sullivan. To know more about our growth partnership services, email us at digital@frost.com. Thanks again for tuning in.